Hello, everybody. We're going to start in just a few more minutes. You'll have the chance to ask me questions in the chat on the program I gave on the brain. Um, and please go ahead and ask questions on these issues, and I'll be happy to answer them for you.
Here we go.
Okay.
Now you should be. Let me see what it shows on now.
Going live.
All right, is it going live? Now you're live. 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 You're live.
Is it correct?
Hi, everybody. I hope now this technical difficulty is over with. Thank you for saying, "Oh, my word, Dr. Campbell, you have changed my life, my health life." Thank you for such kind words. As you can see from the color of my hair, I've been doing this for a long time. I've published over 100 studies. I've taught this at 6 universities to the faculty, not to students at medical schools. I'm forever thankful to you. I am 6 months on itraconazole, waiting now for my new test results from MyMycoLab. Should be this week. Wonderful. I look forward to seeing those results with you. Please feel free to ask questions. I'm sorry about the technical difficulties earlier. Okay, here's some more questions coming. How do you go about getting a prescription for the itraconazole? I suggest you call me. I'm sorry. You email me. I'm going to put my email address in the chat. So now you have my email address. What does it mean when IgE goes down but IgG goes up? Let me explain that. IgE tells you two things. One is IgE tells you if there's mast cell reactivity, meaning causing mast cells to activate and cause problems principally in two areas, possibly three: the brain, the gut, and possibly the skin. Eczema is the most common one. IgG indicates what is currently inside you, what is now inside you, not what is in your environment, what is now inside you. It tells 14 mycotoxins. How much of each is inside you now? And if your IgGs are up and your IgE as in Edward, are down, that indicates usually colonization. What does that mean? that sometime in the past you were exposed in an indoor environment to toxic molds, and these caused this problem you're having now. The best test for heavy metals, and this came in an email as well, so I'm glad you asked, is Doctors Data Inc. DDI. David, I as in Ian. Do the hair test. They ask you to get a little bit of hair from back here and send it in. And that is, as a toxicologist, I can tell you the best way to determine heavy metals. Not urine, not all those other things. Wondering, I took the MyMycoLab results to my general practitioner, and he was more than happy to give me the prescription for itraconazole. I'd been sick for 15 years. And folks out there, I hear this every day. I've been sick for 5 years, 10 years, 15 years. I've done binders. I've done this cycle of glutathione and binders and glutathione, and I'm still sick. And I say, stop. Stop those things. They don't work. There's no medical evidence that these two things have anything or help anyone with issues with molds and mycotoxins. Stop. How soon after leaving a moldy environment will you see positive changes in blood work? These are toxins. Let us say it's heavy metals. Toxins are molecules. Mycotoxins are molecules. Heavy metals are molecules. Glyphosate is a molecule. And let's say you work in a lab where there's mercury and there's mercury fumes, and you leave the lab and you travel all the way to New Zealand. You think the mercury that's inside you is just going to go slowly dissipate away? No, it's going to stay inside you until it's treated. The same thing with mycotoxins. Just leaving the space, which is the first step to healing, is it's not going to go fade away slowly because of time. They're still going to be inside you unless they're treated and removed. We're having trouble to get the itraconazole in the United Kingdom. Yes, I've heard this many times before because doctors there are, for whatever reason, are not up to date on these issues. Any help you can get? Well, there are a couple of places in Europe that can help you. Just email me, and then I will email you back where you may be able to get the itraconazole from. If a 7-year-old child tests positive for chronic Lyme from Immunosciences lab and has mycotoxins, do you recommend treating? Which one do you treat first? That's a very good question. Here's the answer. Mycotoxins are toxins. Lyme is a living bacteria. Mycotoxins affect the immune system. Lyme causes a lot of inflammation mainly. The symptoms of Lyme is mainly due to the inflammation it causes. Okay? So first you get rid of the mycotoxins, and then second, you treat the Lyme. And Lyme treatment is 2 to 3 weeks and you're done. In a little bit of more time, I'm going to do a YouTube just like I'm doing now on Lyme. So you'll see all the information on Lyme. But the point is, first, always treat the toxin. Because toxins and mycotoxins, let me tell you what mycotoxins are. They're carcinogenic. They're toxic to the brain, toxic to the liver, toxic to skin, toxic to the kidneys. They change DNA and RNA. So first, always treat the toxins, then treat the infection. So when do you take the itraconazole? Morning and evening with meals, usually breakfast and dinner, and that's perfectly okay. When you take it with food, it helps absorb it and you quicker. That's the reason for taking it with food. Can mycotoxins be free from mold particles in the air? Let me explain. When there's a wet environment in an indoor space due to a water leak, it could be a drop a minute. It could be behind the dishwasher. It can be behind the washer and dryer for clothes. It can be behind the tiles in your bathroom. 1 drop a minute. Okay. So that's enough to cause molds to grow. And when they grow, they release spores. Just like when plants grow, what do? They release seeds. Okay. Well, molds produce mold spores that carry mycotoxins. So human hair is about 100 microns thick, and mold spores are 2 to 4 microns thick. And they are the ones that carry the mycotoxins. You breathe them in, they go to the deepest part of the lungs and then transfer into the blood and go through the body. First place they go to is always the brain fog, short-term memory loss, sleep disturbance, confusion, anxiety, depression, personality changes, mood swings, all that. You should sell t-shirts that say, "In God we trust, all others must produce." Data. Thank you for that suggestion. It's a great idea. Are there any extra safety consideration you used when using itraconazole with patients who have a history of heart attack? I know there's a warning for heart patients on itraconazole. Itraconazole is basically an antifungal. It kills the spores that carry the mycotoxins. When you kill the spores, there's no more mycotoxins. Itraconazole is a medication, and it can interfere with heart medication, but not the heart. So HEPA filters can stop mycotoxins because they're attracted to spores. 2 to 4, remember, hair 100 microns thick, spores 2 to 4. There's currently no filters that reduce that, because if there would, mycotoxins are 2 to 4 microns. I'm sorry, mold spores are 2 to 4 microns, and mycotoxins are 0.1 microns. If there would have been some way to stop that kind of size, they would have done that during the pandemic we went through a few years ago from COVID. And there would have been these HEPA filters all over the planet. It doesn't stop it. You're currently on the protocol. And when is the best time to recheck your blood work regarding the mycotoxins? Prior to completion of the protocol or after the protocol? The protocol is 6 months. So when you start the protocol, at the end of 6 months, you retest. You don't have to stop. You don't have to stop the itraconazole, the supplements, the vitamins, nothing. because they're not going to affect the test. So you do the protocol, and at 6 months of treatment, you repeat the test. So mycotoxins can be in the air free from mold particles. Mold spores carry mycotoxins. So the spores are in the air and you breathe them in. All you need is a little ball of mold spores somewhere in your air conditioning, heating, ventilation system, and they're going to be producing mold spores all the time, and you're going to be breathing them. Can mycotoxins cause inflammation in the eustachian tubes, which are in the ears, causing hearing loss? Any recommendations if someone has to fly to Europe with this? Well, let me explain to you. Years ago, we published a study with another couple of doctors on how mold spores that carry the mycotoxins, and the mycotoxins cause acoustic neuromas. They affect the acoustic nerve, so your hearing is affected. What can you do about flying regarding, pressurized air cabins and all that? Nothing. You need to just get treated, and it gets rid of it. This is a great question. Which diseases is mycotoxin illness most commonly misdiagnosed as? Why is it a great question? What does the World Health Organization call mycotoxins? The World Health Organization calls mycotoxins the great masquerader of the century. It masquerades as chronic fatigue syndrome, POTS. It masquerades as fibromyalgia, autism, PANS. Here you go, folks. Dementia, Parkinson's, multiple sclerosis, things of the brain. All those. If you go to my videos on MyMycoLab YouTube channel, you'll see patients who had obvious dementia. 6 months later, they're normal. And you see the pictures. You see pictures with MS, young people coming in wheelchairs. A few months later, they're walking. Many, many, many pictures. Please watch those videos on MyMycoLab's YouTube channel. The before and after pictures. Just curious how the body removes the toxins, for example, the mold, mycotoxins, fungus. Would we be able to see it in our stools? The answer is, if your hair is 100 microns thick and mold spores are 2 to 4 microns thick, how are you going to see these spores? And mycotoxins are 0.1 microns, the same size as a COVID virus. Did you ever see COVID virus during the pandemic floating around in the air? No, you can't see them. Where can amphotericin B nasal spray be compounded? That's a good question. Dr. Ponikow, chairman of the Department of Ear, Nose, and Throat Surgery at the Mayo Clinic, did a study on chronic sinusitis in 210 patients. Took them to the operating room, cleaned out their sinuses, and what the material was, sent it to the lab, and asked the lab, identify what is the most common cause. The lab came back 96%. 96% molds, fungi. Dr. Ponikow petitioned the society, the Ear, Nose, and Throat Society, that the term chronic sinusitis be changed to chronic fungal sinusitis. So, you're not going to, your amphotericin B, along with itraconazole, is going to clear the sinuses out. It's a 0.03 normal saline solution. You squirt it twice a day in each nostril, morning and evening. I have to tell you that one of the many symptoms that I have had went away, and it was Raynaud's phenomenon. Unbelievable, the difference. What the doctor is saying is true. Yes. A lot of autoimmune diseases are caused by mycotoxins. Remember, folks, my autoimmune diseases, MS, lupus, rheumatoid arthritis, skin autoimmune disorders such as psoriasis. I have pictures that are in these YouTube videos before and after. Here, these terrible lesions on the skin and terrible inflamed joints from rheumatoid arthritis, gone in 6 months. What about biofilms? In God we trust. All others have to show data. How much is known about where the mold could be growing in the body if it is not sinuses? I know the itraconazole is systemic, but I wonder. Well, very common. The lungs. One of the common diagnoses is pulmonary aspergillosis. In other words, aspergillus in the lungs. It's a diagnosis. So lungs, sinuses, and other parts of the body. Do mycotoxins in the body or spores create biofilms to avoid immune detection? No. Again, in God we trust, all others have to show data. There's a lot of, if you want to believe Dr. Facebook or what some websites on Dr. Google say, I always say, show me the data. Show me that what you're saying is correct and true. Show me the studies that say this is correct medically. How do you determine if you need itraconazole nasal spray? In other words, how can you differentiate between mycotoxins or just seasonal allergies? Well, the mycotoxins and mold spores in the nasal sinuses are chronic all year, not only in the spring or in the fall. That's how you tell the difference. Has there ever been any consideration for creating an anti-mycotoxin like an anti-venom? Yes, itraconazole, Sporanox, voriconazole. They've been around for 20, 30 years, 40 years. Has there ever been any, do you need to be off itraconazole before retesting at 6 months? No. Itraconazole is not going to affect antibodies being made by the immune system. The only thing that can affect the test are corticosteroids. In other words, things that suppress the immune system. So corticosteroids or chemotherapy. Why is conventional medicine so eager to give antibiotics but rarely check for fungus, candida, mycotoxins? I've asked my colleagues why. Why is it? They say we get these patients who believe they have a mold issue and they bring us a stack of papers they printed off with Shoemaker, Neil Nathan, and so on and so forth, and they say, do this. I'm not going to do that. There's no evidence that that works. Let me ask you a question. Why do you think the CDC and the FDA do not recognize urine testing for mycotoxins? One, because they're not validated tests, and each lab has a different method of making it, and different, this is positive if this lab you use, or this is positive if it's that lab. Second, in urine, it's an excretion. It's what's left the body. Let me give you an example. Milk, 91% of milk, the kind you buy at the supermarket, milk, regular pasteurized milk in the boxes, 91% contain anywhere from 1 to 4 mycotoxins, but they're in parts per billion. Way too small to cause any kind of a health problem. So what does your body do? It pees them out. And so the CDC and the FDA say, well, that's just an excretion. Urine is getting rid of it. It doesn't mean you're sick from it. Third, these labs can't validate that this is a real test. So that's the point. Why does the FDA and the CDC not recognize urine testing? But they do recognize blood tests, like MyMycoLab's blood test. How often do you see issues when a wall is responsible for the mold exposure? Our MyMycoLab exposure went up, and we found a pipe burst in a neighbor common wall and grew mold. Again, mold will release mold spores in the air, and these mold spores will spread all over. It takes, according to studies, published studies, 6 weeks from when mold starts forming and releases the spores for the entire place to have mold spores. Is there a paper that shows that IgG results can go down after being removed or treated? Running into doctors that seem to think it's not the case. Yes, I want to let you know. Go to the NIH, National Institutes of Health website on molds. There's how they say it can cause allergies, but it can cause cognitive problems, brain problems, immune problems, etc. And at the end, they give 16 references. Number 8 is a chapter in a medical textbook on how molds and IgG and treatment and all that. That chapter was authored by me. So if the NIH, National Institutes of Health of the federal government of the United States, is relying on that, you should too. After 6 months of treatment and house remediation, tests just came back with IgE lower, but IgG is higher in some areas, but feeling better. What does this mean, and how long can someone stay on the itraconazole? Usually when that happens, it's usually because the patient did not take the real treatment, meaning 1 is itraconazole, 2 is 8 specific vitamins and supplements at specific doses. Not something you bought online, not something you went to the store, whatever store, and you bought there and thought it was well. No. Let me show you what I mean. This is a study that was published September this month. In it, what dose of vitamin B, what dose of melatonin, what dose of vitamin D3 helps detoxify people? Okay? The point is, you got to do the right thing, and it's what I've put out there in all my videos. It's not that difficult. It's specific supplements and vitamins at specific doses. Not, and please forget binders. Binders work great in animals, rabbits, sheep, rats, chickens, piglets, all that. There's no evidence they do anything in humans. So if you follow the right treatment, you get rid of everything. And so, yes, the IgG goes down, and that was in that chapter that I discussed. What would you do if an institution is relying on outdated information? I would go away. I mean, just think about it. What happens if they think that Lyme is actually a fake disease? What happens if there's something that they're relying on that was okay 50 years ago? You remember the ads? My doctor smokes Chesterfield cigarettes. Sorry, just ignore them and go somewhere else. I'm currently fighting to have insulation removed from my attic that's been sweating with no ventilation for 9 years. I'm struggling to get doctors to prescribe me itraconazole long term. I get about 20 to 40 emails every day, 7 days a week, 365 days a year saying this. So this is what I would say to you. First, make sure that's taken care of before you start treatment. There's no use in starting any treatment until you're clear, you're in a clean environment, and there's no more molds or mold spores or mycotoxins. That's number one. So you've got to do that first. Get rid of that. Then if you do the testing with MyMycoLab, anyone that does the testing gets a complimentary consultation with me or my associate, Dr. Lauren Tissier, who is famous for her website, Life After Mold. And we will help you find the person in your area or in your country. Any other questions, folks? Feel free. Remember, please watch the video, The Brain. You're not asking me a lot of brain questions. This is why I mentioned that. I recently started the protocol with the that's detoxpure.com. I'm also adding Omega Q Plus Max and fatty acid supplements. Is this okay? I would just go with what is recommended, not adding other things in. There was a time where I used to recommend Omega Q Plus Max. The problem is that was a supplement developed by my colleague and friend, a great man, a great cardiologist from Connecticut, Dr. Steve Sinatra. Unfortunately, he passed and the company was sold, so I can't vouch for the other people that took over. What helps with social issues? I'm not sure what you mean. What are social issues? Do any states have laws about environmental mold? Pennsylvania Health Department didn't take it seriously and said that mold is unregulated. You know, every state is its own entity. I can tell you that, for example, let's take an example, Connecticut. Schools are famous for being moldy. Well, in the state of Connecticut, if a teacher gets mold mycotoxins, et cetera, it's workman's comp. Is Lyme really cross-reactivated? Having Lyme test positive, trying to treat it, but seems like getting nowhere. There's a lot of misinformation on Lyme, and that will be my next webinar. And after that, it will be my next YouTube with all of you. There's a lot of misinformation. There is one and only one lab that does the correct testing for Lyme in the United States. And it's even patented. And the name of the lab is Immunosciences Laboratories, and they're in Los Angeles. The other Lyme tests, immunoblot, PCR, etc., are not valid tests for Lyme. That's why you're not getting anywhere. 7-year-old on itraconazole for 2 months, treated with tested high liver enzymes, etc., after 2 months. Then after 2 months off itraconazole, I would, two things. Is this 7-year-old taking the whole treatment or just itraconazole? Second, I would switch to Sporanox. Folks, remember this, and this is important. All generic medications, whether it be itraconazole or any other generic medication, blood pressure, heart, whatever, anything, are made in India and China, and sometimes it's not the greatest. I won't go any more than that. I love Indian food, I love Chinese food, but anyway, the point is, that's when you go to the original. The brain fog lifting was one of the first things I noticed changing on itraconazole. I could think again. Yes, because the first place mycotoxins go is the brain. We published these studies back 20 years ago. I've published over 100 studies, folks. I've taught this at medical schools to faculty, not the students, the faculty. I've lectured, God, in hundreds of medical conferences to thousands of doctors. I know what I'm doing. Look at the color of my hair. I've been doing this for a long time. Is taking amphotericin B nasal spray required together with itraconazole supplements only if you have chronic sinus problems? That's the only time. Anything to band-aid social issues in a mold colonized kid who is on protocol, adrenal support. Don't do this adrenal business. I need evidence, and there's no evidence. I understand it's not easy, especially with children. I want to tell you about these twins that I treated, and it's in photographs in my webinars that are on YouTube channel. They came to me, mom and dad, with these twin boys, 5 years old. Forget any social, etc., all these problems, as you know, autism. A year later, they were fine, and they went to normal school. Imagine this. When they were 18 years old, they wanted to see me again, and they took me to lunch because they had just been accepted to university study industrial engineering. Another case. This is a 23-year-old autistic child. Boy had never, this 23-year-old, I can't say he's a boy, he's a young man. 23 years old, never spoken a word in his life. 5 months into treatment, he begins speaking. Can you imagine how that mother and how that father must have felt that their son is going to be well again and normal? Detox Pure told us they don't ship to Europe. That's correct, because there's all kinds of rules about what can come into a country and can't come into a country. The only way to do it is to have a relative send it to you. or a friend send it to you. For example, I have folks in the island of Crete who are patients. I have to send it to their relatives in Germany. I mean, they have friends here who are Germans, and they have their other relatives in Germany, and the German relatives send it to Crete. Unfortunately, this is customs, the barrier, the customs barrier. Are there any other molds that produce zearalenone besides fusarium molds? No. Is there any part of the brain that mycotoxins cannot affect? Motor control, visual cortex, nervous system, etc. So let me answer that with what published studies show. I'm going to mention two studies. One on Alzheimer's disease. They took Alzheimer patients that had died, and at autopsy, they looked at the brains and looked if there's any mold in the brain. They found mold in every single part of the brain, including the cerebral spinal fluid, the one that people do a spinal tap for. That was one study. Another study looked at Parkinson's disease. People who had died, who had had Parkinson's disease. There was mold in every part of the brain, including the cerebral spinal fluid. What did they say? They said, and they showed actual photographs, microscopic photographs of the mold in the brain. So there is no part of the brain that is spared. We got our house tested for mycotoxins a year ago, and it came back positive, over 10 parts per billion of ochratoxin. I don't believe that this real-time laboratories analysis is accurate at all. And I checked with a building engineer, and he looked at it and he says he does not recommend it. How long after 6 months of treatment and high IgGs on retest can I take this itraconazole when I do a retest again? I would question, why do you have high IgE still? Is it because you're colonized in your nasal sinuses, or what are your symptoms? I need to know a little more to be able to help and guide you. Thoughts on adding high-dose thiamine on the protocol? In God we trust. Show me the medical evidence. DetoxPure.com has the right vitamins and supplements at the right dosages, and that includes the thiamine. What about HBOT? I have a very good friend I've known for decades, Dr. Paul Harsh in New Orleans, who wrote the book, The Oxygen Revolution. He's a brilliant man. Mycotoxins, HBOT, doesn't really help. I had a high CRP at 1.3 for 15 years. Just had it tested after 6 months of itraconazole. It's now 0.8. It's a miracle. Sorry I'm so chatty, but just so grateful for you doing these videos. Thank you, kind words, for your kindness. I appreciate that so, so much. In New England, my primary doctor referred me to a pulmonologist, and neither wanted to prescribe itraconazole. I know I lived with mold and have sinus contact issues. Where do I go next? Did you do the test? And if you do the test with MyMycoLab.com, you get a complimentary consultation with me or with my colleague, Dr. Tessier, and then we can guide you to who can help you in your area. My family member is on Cresemba due to having issues with itraconazole. She's also on amphotericin B nasal spray. What is the question? Will everyone who get exposed for long enough eventually get sick? Oh, these are toxins. Okay, how much mercury do you think you need to have in your body? You know the answer? 0. No toxins. Nothing. With neuropsychiatric conditions having been caused by mycotoxins, specifically including eating disorders like anorexia nervosa, purging, and schizophrenia? Absolutely. The chairman of the Department of Psychiatry of a major medical school sends his patients who have these kind of problems, their serum, to MyMycoLab. Why? Because these problems are known to cause neuropsychiatric problems, and there's many publications and studies that show that, from Harvard, from Johns Hopkins University, from Tufts University School of Medicine. There's many. UCLA. Why can't we just do a slow drip of IV itraconazole? Because it's not enough. First, you got to be out of the environment. Second, you got to repair the damage and take itraconazole. It's not just, I'm going to get some itraconazole. The treatment is 4 parts. First and foremost, before you start treatment, it's the first rule of toxicology: get the patient away from the toxin, or the toxin away from the patient. You've got to be out of the toxic environment or have it cleaned up. Then you start itraconazole. 8 specific supplements and vitamin at 8 specific dosages. Why? Because that's what studies show works. Some people say, if this works, this much works, I'm going to take more. Maybe I'll get better quicker. No. This is what's been studied and written. This is the exact dose that you need to take to detox yourself. Third, you need an anti-inflammatory, low histamine nutritional plan to eat. And that's it. Which neuropsychiatric conditions have been caused by mycotoxins, specifically including, I discussed that. In answer to your question, I'm feeling pretty good since IgGs are higher after 6 months. How much longer should I stay on the itraconazole until they come down? Where can I get a doctor to prescribe Sporanox? Where are you on the planet? I don't know if you're in Indonesia or Des Moines, Iowa, or maybe you're in Paris, France, or Malta. It depends. Have you known anyone with geographic tongue who got better on protocol? I have low IgE, but believe colonized by my IgG numbers. It's very common to have geographic tongue with that problem. Of course. Do mycotoxins ever cause gum irritation? Not only irritation, but they cause gum disease. Do you do house testing? I'm a medical doctor. I'm not a house doctor. So no, I don't do, and I don't trust labs that do that. If you go to MyMycoLab's YouTube channel, I did 2 videos with a building engineer, Brantley May, and he gives you each test, the pros, the cons, what is good, what is bad. If you get an inspector, don't just say, come in and inspect my house. You tell them, he puts on there what you need to tell your inspector to do. That's where I would ask you to view that. Everyone hit the like button on this video so YouTube pushes it out. Thank you. The itraconazole Cresemba question was if Cresemba is an acceptable alternative. As my family member had issues with itraconazole, no, it's not. Unfortunately, I'm so sorry. Any other questions? Keep asking, folks. I'm here, and it's here to help you understand and learn. I'm here to educate. I'm here to help you not use fake stuff, because there's a lot of fake stuff all over the internet. Living in Mississippi, recommendation for a doctor to prescribe Spornox? Yes. Actually, I have a there's a doctor, and anyway, just email me. You have my email address in the chat, just email me. If I were to write a memoir on my journey, can I mention MyMycoLab so there's awareness? Absolutely. I have a patient. She wrote a book, Are You Moldy? How will we know if we need to upgrade to Spornox? It's not really an upgrade. It's a switch. If you take 95% of my patients do fine on itraconazole, 95%. That other 5%, they say they don't feel so good. They've got acid reflux. They've got this and this when they take itraconazole. Those are the ones I switch to Spornox. Any current studies going on now with protocol? Several. I mean, I've published over 100. I continue publishing. I'm currently looking at 3 more publications. So yes, the 3 I'm looking for publications is one is on breast implants, which I'm doing with Danielle Valores, who's a spokesperson for breast implant illness. The other one is on the issue of autism that just came out recently in the news about acetaminophen, otherwise known as Tylenol, and autism link. And the third one is on mast cell activation. Which do you prefer, liquid itraconazole or pill form? My doctor has me on the liquid. Absolutely the capsule form, not the liquid. I forgot already because the memory is really bad, so that about the house testing, go to YouTube, and that was the title. In the YouTube, what you'll see is a photo of 2 people on the same video. One is me, and the other is Brantley May, the building engineer. And there's 2 of those videos. Is there an amount of time that you should stop itraconazole if the IgG still get high? Can a person be on it for 2 years? Rarely. Of course, I've been doing this for over 30 years. It's rarely more that long, very rarely. Have you ever seen mold illness complicated by long COVID? In my case, I get a dull chest pain in each upper airway in response to smelling smoke. Well, folks, there's some very interesting studies that came up on long COVID. So, again, in God we trust, the rest have to show data. So there was a study that was done on long COVID. And the question they posed in that study is, could long COVID be due to the fact that during the pandemic, people stayed at home. They didn't go out at all very much, not like today anymore, or before the pandemic, and that in their home there was mold. Another study came out on 100 patients with long COVID. They got treated, these 100 patients, with itraconazole, and all 100 got better. Long COVID patients. Third, another study showed that in long COVID, the most dangerous aspect is getting mold in the lungs. So, should a colonized mom breastfeed her baby? No. Let me explain. Mycotoxins cross the placental barrier during pregnancy, and they can affect the fetus. And after birth of the baby, mycotoxins can come out in breast milk. And this is in one of my videos as well. It's called the first 1,000 days of a child, meaning from conception on. How long does it take amphotericin B nasal spray to start relieving sinus issues and ear pressure and dizziness? Usually at least 2 months. We're currently waiting for an appointment with you, doctor. I have a 9-year-old that has been on several protocols and she still has food allergies and is not gaining weight. I look forward to talking with you. Is it normal for liver enzymes to be high while on the itraconazole protocol? If so, how much higher? I only see elevated liver function tests as maybe 1 or 2%, and those I change to Sporanox and it goes away. Does itraconazole ever develop resistance to fungus if taken for a long time due to failed environmental mold remediation? There are no studies that show that. How much is known about the mother colonizing the mold in the children during pregnancy? There's many studies on that. And it's in that video I did on mother and child. It's in YouTube, MyMycoLab's YouTube channel. Which of the supplements repair the damage? All 8 specific supplements at those specific doses. Is there an itraconazole capsule dosage for children that can swallow them? In children, itraconazole is dosed according to weight. And it can be brought down because in younger children, they don't swallow pills, Mac capsules. So there's 2 ways. They can make a syrup, or they can open the capsule and sprinkle some of it in on some juice or food. Any other questions, folks? We're getting to the end of the hour. And I've enjoyed helping all of you. And we're going to do many more of these. The next one is Lyme or mycotoxins. Is it this or is it that? Because the symptoms are very similar. Do I know anything about SETI drops? Not a thing. Is mycotoxin anxiety feeling from the brain chemicals or from hormone imbalance? It's both. Mycotoxins are known to affect hormones. What do I mean by that? They're known to cause Hashimoto's thyroiditis in the thyroid. They're known to change the imbalance in women between progesterone and estrogen, causing all kinds of problems, including infertility, problems with menstruation, etc., and very difficult to treat unless you get rid of the mycotoxins. And in men, They lower testosterone almost to nothing. Awesome session. Keep them coming. Thank you so much. I appreciate that very much. Hi, thank you for taking questions. I'm wondering why my blood test came back without showing any high exposure to a toxic mold if I was exposed to that cause. Well, let me ask you this. If there was 0, it would have been in the blue column. If any amount of toxin, even low amounts, how much mercury is it okay to have in the body? None. How about arsenic? Is it okay to have just a little bit of arsenic? No. What about glyphosate? No. No toxins in the body. Sporanox is very expensive. How can I get this covered on insurance? I don't know which insurance plan you're on because, for example, when I was practicing at the medical center in Texas, Houston, there were just Blue Cross Blue Shield had 32 different plans. I can't function in that world. I function in the world of medicine. What is best for my patient, not what is best for the pocketbook or the insurance companies. Do I recommend detox baths? No. Folks, we're getting to the end, so please ask more questions and then I'll close it and I'll see you at the next one. What was the heavy metal test website again? It's called DDI, David Ian, or Doctors Data Inc. Are there people out there so sensitive to mold that they can't live indoors and have to live in a special mold-proof house? Many patients of mine live in tents until they get red and they get well. Once they're well, they're fine. Well, thank you very much. You are amazing, and I appreciate you so much. Thank you so much for your kind words. I really appreciate all your kindness that all of you have mentioned. Oh, here comes the foot baths. Yes, they're going to detox you by your feet, by the soles of your feet. No, folks. That's what I call woo-woo medicine. Woo-woo medicine is binders, glutathione, ionic foot things, all that kind of stuff. Okay, well, it's been a wonderful hour. I thank you so much for listening and giving all these questions. They're all very pertinent and good questions. And I appreciate everything you've done in your questions, because when I answer one question, a lot of people hear the answer and it answers their questions as well. If I've done a test through MyMycoLab, can you give me some guidance? With every MyMycoLab test comes a complimentary Zoom with me or my associate, Dr. Tessier, and of course we help you. If a loved one will only take itraconazole pill at this point, will that be okay without supplements? No. It's like a four-legged table. You take one of the legs off, it falls apart. My daughter has done many oat tests real time, and I'm looking forward to doing your testing as recommended. Thank you. By the way, oat tests and real-time labs are not validated tests. They have no validity in medical science. I was living in mold condition for years, tested for mycotoxins positive. I moved out almost a year ago, but still have symptoms, headaches, etc. I'm in LA, California. Can you recommend a doctor? Do the test. Once you have the results, you get a complimentary Zoom call, and then we see what the test showed and we discuss it. Do you have any advice for finding a new place after moving out of a moldy apartment? That's not really a medical question. Alrighty, folks. We have looked for mold in my house through different companies, even the dog, and we haven't found it. What can I do? It may not be your home. It could be your car. It could be where you work. It could be the gym you go to. It could be wherever you go to on a regular basis. If I've had this for over 20 years, is it possible to be reversed? The havoc that I've been through? Absolutely. I have patients who've been sick for decades. And they get well. Like if you go look on, if you watch the video that this is all about, you'll see a picture of a woman who had Alzheimer's, dementia. 6 months later, you see her well again. And the answer to your question about, I've had this for over 20 years, is from the next one. Yes, I'm living proof. Okay, folks, have a great rest of your week. This is Dr. Andrew Campbell as a courtesy from MyMycoLab. Thank you for being here. We'll see you at the next one on Lyme. Epsom salt baths, don't do anything.